Project at the University of Nebraska Medical Center has a new name. The EDGE District looks to bring together entrepreneurs, investors, and businesses related to the health industry. Other amenities include a parking garage, restaurants, and residences. It's scheduled to open early next year and is expected to bring billions into the local economy. Nebraska is lagging behind when it comes to maternal health care. The biggest disparity is seen among Black mothers.
6 News' Taylor Johnson is on your side with how city and county leaders are actively working to reverse the negative trend.
Well, John and Aaron, Nebraska's preterm birth rate has been on the rise since 2020. You can see those numbers there, with as many as 135 babies who died in 2021. Now, maternal health care problems are impacting all women, Black women, and their babies are suffering the most.
This is a crisis, and Black women and birthing folks are dying as a result.
Black maternal health is what Douglas County Commissioner Maureen Boyle is referring to. Last month, the board proclaimed October as Black Maternal Health Month. While awareness is being raised, the state is falling behind significantly.
Nebraska has the second highest difference between white and Black babies' death rates in the nation.
Nebraska received a D- for preterm birth rates on the March of Dimes 2023 report card. Douglas and Sarpy counties and the city of Omaha were each graded an F, indicating their rates got worse between 2021 and 2022.
Obviously, we have a lot of work to do.
Sydney Shedd is a birth justice worker with IB Black Girl.
So when we talk about birth justice, we're talking about creating better access for families to get the care that they need in the way that they would like. Equitable care, comprehensive care, and culturally sound care.
Shedd is also a doula, someone without obstetric training, giving guidance and support during pregnancy or postpartum.
Working with a doula can help improve outcomes. There's less cesarean rates, there's less rates of episiotomies, and just better outcomes for mom and baby all the way around.
Data shows 2 top factors impacting preterm birth are diabetes and hypertension, illnesses often plaguing the Black community, according to the CDC.
What can I explore to maybe make some changes in my diet, or look at alternatives to exercising now that I'm maybe going to give birth and need to take it easy.
Collaboration is something Shedd and Douglas County leaders say needs to happen to raise Nebraska's failing grade, but they can't do it alone.
So not only are we hearing from stakeholders and folks that are trying their best and doing the work right now, we're taking what we put together, giving it to the community and saying, what do you think about this?
All month, IB Black Girl is hosting events and educational programming about Black maternal health. We have how you can get involved on our website, WOWG.com. On your side in the studio, Taylor Johnson, 6 News.